My name is Vita Tolerson. I am the wife and caregiver of a TBI survivor. I was told that he had a seizure while he was driving and went off the sidewalk, hit a tree, spun around, and slammed into a brick wall. He was extracted from the car and airlifted to UAMS in Little Rock. At that time, I was in the hospital with my middle son. He had been bitten by a cottonmouth. So he was discharged the day of the accident at exactly the same hour that he had the accident. I ended up Ubering from Little Rock Children's Hospital and going to UAMS with a 14-year-old in tow and a swollen arm, looking crazy because we had just spent 5 days in the hospital. It was during the beginning of the shutdown. I almost didn't get in, but because I guess of the situation that everything had happened, since I just Ubered from one hospital to the other, you know, they put you in that room that you never really want to be in the family room. And there they had kind of explained what happened. I got to see him while he was in Trauma 1. It was only for like about 2 hours. Then once they were taking him up to ICU, I was no longer allowed to see him. He was diagnosed with a grade 3 severe diffuse axonal injury. He also had subarachnoid hemorrhaging, frontal lobe damage, and lesions in his brainstem and his corpus callosum, among other things that I can't really remember. There were quite a couple of things going on. He didn't have any surgery. He was he was breathing on his own, but he was intubated. The ventilator was kind of assisting him to breathe versus breathing for him completely. There were a couple discussions back and forth about where do we go from here as far as quality of life, but I hadn't seen my husband. There was absolutely no way that I could have ever gone through any of that without ever seeing him for more than just an hour or two. It was just, you know, slight communications back and forth of, you know, how is he doing? And I know that I probably got on the nurse's nerves. I called quite often, but that was all that I could do. The feeling of hopelessness and helplessness is grave because he's fighting for his life and there was nothing that I could do about it. Those 10 days up until I saw him, I honestly just spent a lot of time trying to find things to do to occupy myself. I was a dental assistant at that time and our office was closed due to COVID. The one thing that I would have wished that I could have done was go to work, just, you know, distractions. But I just ended up kind of doing some repairs that we had literally talked about the day before his accident. I had kind of said how I wanted to set up the porch because that was our favorite area for us to just kind of sit and talk and, you know, just spend time together. So I ended up doing that. I saw him on the 31st, the day before the day I was supposed to see him. I was told that, you know, I can go in, that they had made an exception for me to go in and get some training before he went on to the LTAC. So that's when I did some trait classes and I was able to see him. Oh, I was a nervous wreck. I was jittery. I just wanted to cry, you know, but you have to hold strong throughout all those moments because you have to be the one to step up to the plate. I was with him for about 3 hours, which was a lot more time than I thought I was going to be. While I was there, the first thing I did was kind of bathe him up because he was, you know, he was a little grungy. And that's as expected. He had just had a really bad accident. So I did the best that I could. I put on some music, his favorite radio station. I talked to him and then I gave him a little bath. They put him on the ambulance and they brought him to the LTAC. And that was the last time that I saw him until May 1st when he came home. It was very hard to communicate between, you know, the patients and the doctor, the family or the nurses, you kind of miss that one-on-one interaction that you get to be a lot more involved in what is going on with your significant others. So, you know, I had to dig deep and find my own way to find my resources. I'm not the only person calling to check up on their loved ones. And I know that the nurses were jam-packed because everything was kind of a little crazy then. It was just starting. So nobody really knew what they were doing. I had learned that his vitals were very important. And the best thing that I could do was make sure that I had his vitals, you know, like how his sugar was, how his blood pressure was going, heart rate, breathing rate, anything and everything that you can think of medically that I had learned in that time and due to past experiences. And that way I was able to gauge a little more on how he was doing based on kind of like his vitals. At the LTAC that he was at, they refused to have me see him. I tried on a couple occasions because I wanted to know what it was like to care for somebody with a TBI. I didn't know. And at that point, he was in a vegetative state. So what do you do? How do you do it? How, you know, do you learn to do things that you've never seen anybody do? When he came home, he wasn't in the best of conditions. It was scary and sad because I had no idea how to take care of him. I didn't know, you know, prior to these events what a peg tube was, or having to, you know, turn somebody every couple of hours, or just having somebody fully dependent and being completely lost. But when he came home, I just dove into it because I was the only one there. If I didn't do it, nobody else was going to. The first 2 weeks felt like 6 months. They were the longest days that I have ever experienced. I felt like so much time went by in such a short period. And everybody was kind of acclimated to our new schedules and our new life while learning more things. Because, you know, at this point, I had to learn therapy. He was very heavily congested. He had a pneumonia a couple of times while he was in the hospital. And I had to learn how to, you know, do techniques and massages. When he came home, he opened his eyes, but very, very sporadically. He was extremely agitated. He was storming quite a lot. So his heartbeat was all over the place. He was always sweating. And he had, you know, just slight temperature. But after that, we kind of fell into like this really good rhythm. Things got easier. They got a lot easier. And he started progressing. He can communicate through blinking yes or no questions occasionally. Nothing is still at the point where it's extremely consistent. He has his days where he's just kind of not really responsive, and others that, you know, he is just involved in everything. Those days that he is involved, he involves himself so much in everything going around that, you know, by the time you know it is 3 or 4 o'clock and he hasn't had a nap, and now he's just really angry or agitated because he's overstimulated himself. I lower the lights for him when I see he's kind of just really looking around. So even though if he doesn't nap, he's still in a low stimulation environment. Getting to know what overstimulates them and how was work. It was work. He needed a really good bath the day that he came home. But since he came home late, it was like 7 o'clock at night or about 8. I didn't do anything with him that day, but I did the next. And oh my goodness, I had no idea what overstimulation was. And I learned very quickly and hurtfully what it was. It was very scary. I learned to adjust and his cues, because he'll give you cues of when things are just kind of too much for him. So he will also, at this moment, he will follow certain commands. He can reach for things. He can squeeze my hand. He's very quick to let you know what he does not like when you do it. Will kind of like moan and grunt out, or he'll growl in response to, you know, things that he just doesn't want you to do, even if it's kind of like when we do his PT. So he's usually never happy during PT. But I just reassure him that it's something that must be done and that it is a bother right now, but in the future it will help him. And right now, the main goal is just to get him to be the best him he can be. And that is where everything just turns into a beautiful moment, because you get to see those advances all the way through. And, you know, I've said it before that you celebrate all the small steps. These small steps are so much, because us as normal people, we're kind of blind to how much our brain actually does for us. And in situations like that, you learn that it takes so much for them to just kind of open their hand or move their hand. And right now he's in like a little slow turtle mode, and his hands are really shaky, but you know, he's doing it, and he's showing the world that not every brain injury is the same. The bridges of communication opened up a lot. You know, I did sit down and I talked to them, and I did hold it together, but I did shed a few tears, even though I was in control of how much I was showing, just because I don't want them to feel the burden of my true hurt. But then I also wanted them to know that it was okay to hurt. So finding that balance, but it showed them that it was okay to cry, because, you know, you are hurting. And my husband isn't their father, but we've been married for 10 years. So that's who they know, you know, when
Right.
they have to have a manly conversation, you know, that was who they depended on. So he is their dad, and it was very difficult for them. And not only did they have to go through seeing him in this situation, they had to go through my reactions during initially seeing
Right.
these things. And it didn't hit till about like maybe 2 days after he was home, because while he was in the hospital, I felt like I was sheltered through everything that was going on. Like, I knew things weren't right. I knew that my husband wasn't going to just walk through the door, but I didn't know what was going on because I couldn't see it. So, and neither could they. So we all went through the same progress of, I guess, shock and then acceptance. Because at this point, you're speed tracking everything that you should have been through in the hospital. We're all kind of just digesting all at once, and that wasn't easy. But we came together and we started having like family nights where we would just sit down and play like card games or board games or something that let us just be together and appreciate our time. Because, you know, right now, this is what we have. They're relying on me, I'm relying on them. So we have to be able to feel comfortable enough to share our thoughts as to what is going on. You know, unfortunately, that was the eye opener to how delicate life really is. We had private insurance at that time. And being that he was unresponsive, according to the LTAC, when they called the insurance to see what they can do, because I refused to send him to a nursing home. A nursing home was not an option, especially at that time, because COVID was hitting nursing homes extremely hard. And that was not a chance that I wanted to take. At that moment, he was still suffering from his pneumonia, and he was still storming a lot. I knew that he was lucky to make it through his accident, but I was unsure of how lucky he would be if he went into a nursing home and contracted COVID. I persisted for him to come home. That was the only option I gave them. He was not going anywhere except for straight home. So the LTAC called the insurance, and the insurance said it was either hospice or nursing home because he wasn't giving them the reactions that they wanted, even though they didn't really do anything at the hospice at the LTAC, as far as helping him advance. They just kind of made sure that he was stable and he was decannulated when he came home. They sent him home with the understanding that he was to be on hospice until our private insurance was kicked off to lack of payment. And then Medicaid would step in fully, and then that's when I would be able to advance to home health. He had a really bad time when he came home, and his blood pressure dropped at one moment. His breathing was just kind of really off. I was scared, so I wanted him to go to the hospital because I don't know what I'm doing. I can only have as good of a healthcare background as, like reading in Google can give me, because I haven't gone to school. When I called hospice, one of the weekend nurses, she just said, if you call the ambulance or you do anything outside of what we can do, we will boot him out of hospice. So there was a major disencouragement in me continuing to seek other assistance. And I was told that there was no palliative care in the state of Arkansas. And that right there is just hindering, because the LTAC had gave me the diagnosis that he wasn't passing away. It was just due to insurance issues. I had found out that that is something that happens quite often to patients of TBIs.
When we got involved, whenever I heard your story and the situation that you were in, then I was able to talk to our leadership and go out and make a house call to you. So you're about how far from Little Rock?
I am an hour and a half.
So went out, met with you, met your husband, saw the conditions in, and felt like maybe some things could be done to advance his health. We work with a physiatrist, a physical medicine rehab doctor that is really focused on disorders of consciousness. And, some people would call that a vegetative state or persistent comatose state, which is called disorders of consciousness. And that maybe there are some therapies and modalities that can kind of help emerge somebody from that state. So didn't feel like there's a whole lot to lose here.
Yeah.
So was able to do an assessment and then talk to the physiatrist, and we were able to arrange a telemedicine appointment for you. That I don't think there was any way that we could have gotten approval to take him by ambulance to a clinic in Little Rock for this appointment. So we were able, through the telemedicine program at UAMS, arrange a telemedicine appointment with you, your husband, from your home to the office with a physiatrist, where did an assessment. You were an excellent historian, by the way. And then I assisted clinically with the appointment, the initial assessment. And that audio video appointment was enough for the physiatrist to take him on as a patient and change medications, change some therapies, and start moving forward. And since then, I've had, 3 appointments? It is now the 3rd of December. So you had the initial appointment, and then has it been 2 more follow-up appointments?
Yeah. Yep.
And where is your husband at now in terms of recovery?
He is in a state known as minimal consciousness, kind of bordering between vegetative and consciousness. It's kind of like in that limbo realm. I don't know where we would have been without the telemed. I mean, it was great. like I said, he reaches for things now. His contractures are really, really good. He opens his hand completely. Just the distals of his fingers are contracted now. We got his C-collar off, which was wonderful, because that was another thing that was kind of like just in the air floating around. Like nobody knew when he was supposed to take it off, what was supposed to happen.
So to me, the benefit on the telemedicine appointments had several factors. One is reviewed his medications. And
Mm-hmm.
he's on some medications that might keep him more sedated than we
Yes.
would like. So was able to change some of the medications to medications that would still be therapeutic, but
Mm-hmm.
help wake him up a little bit. She started him on some new medications, and then we talked about different stimulations that you could do. But I think it also, through having video, she was able to see you and see
Oh
her
yeah.
in the environment and the type of care that you're giving him. So now we're moving on to the next state. Now that he is starting to emerge a little bit, he's not completely unresponsive. The talk is bring him in a couple of weeks for rehab. And I don't think that would have happened without telemedicine. I think if you have continued
No.
on the course when he arrived home, then you'd still be in that same state of limbo, for lack of
Mm-hmm.
word.
I don't think there's much of a difference. The only thing that's really different is just kind of being able to put your hands on the patient. But you're able to see things that aren't going on. Like if thankfully he doesn't have any pressure sores, but if he would have one, then it would be something that you can go ahead and have the doctor look at. And that way they can see things instead of having to kind of imagine what is going on. Because if I'm like, okay, you can only explain things but so much. So with that, she was able to see kind of how he responded to stimulation, how much stimulation it took for him to start responding. They're able to check out his skin quality. He has a condom catheter, so they're able to check in case there's anything that is going on there. Just being in his condition, there are so many things that can go wrong, and very many little things, like a UTI or an infection or something like that. And the telemed visits or the telehealth visits allow that one-on-one interaction with the patient, that you would never get just kind of calling and picking up the phone. You can 100% communicate that way, and you can build that rapport because you get to have that, even though it's not face to face, but we're still kind of looking at each other. We're interacting with each other. We are seeing how we react to the things that get said. So many things are open for interpretation, without visually looking at somebody. And I think that makes a huge difference. It's easy. You just kind of have to follow the link. I did have to download a couple of, like video apps, but that's fine. I mean, it's just added on to the million apps I have on there anyway. um, so and all I had to do was kind of like click the link, put my name in, and everything was fine. There wasn't a lot of instructions to have to follow or a lot of different links to go through. So that made things a whole lot easier. I can't say that I know where he would have been if we wouldn't have, bumped into telemed and been able to connect with you and Dr. Moni and, all the other helpful and wonderful staff that I had to communicate with. And that was really due to telemed and the fact that it became a more personal journey versus a more unattached situation.
Looking forward to the next chapter.